The cornea is this clear dome over top the color part of our eye, the iris, that's super important for vision. In this video, we're going to talk about its structure, but we're also going to talk about its relevance to you. So, are you ready to get into it so you can understand a little bit more about the cornea? Yes? Then let's go. I'm your eye show host, optometrist Dr. Ed Wallington from delivercontacts.com, and today we're talking about the cornea. The cornea is this clear dome over top the color part of our eye. When we're looking at something far away in the distance, parallel light rays from an unfocused source comes into the eye, goes through the tear layer, goes through our cornea. Now our cornea actually takes those parallel light rays and starts to bend them, and it asserts anywhere from about 40 to 45 diopters of bending power, of convergent power on those light rays. So the light rays bend. They go through the aqueous of the eye, they go through the pupil, which is just the hole in the iris, and then they go through the lens of the eye. Now the lens in a relaxed eye gives anywhere from about 15 to 20 diopters of convergence power, ultimately passing light through the vitreous and onto the fovea, okay, where light's supposed to focus for our highest central acuity. If light focuses behind the fovea, we call that farsightedness or hyperopia. If light focuses in front of the fovea, we call that nearsightedness or myopia. And if light is stretched over 2 points of focus instead of one, doesn't matter where they are or how far apart they are, we call that astigmatism. Notice that the cornea does anywhere from 2/3 to 3/4 of the bending of light for the eye. Okay, that's the majority of the focus for a relaxed eye for vision. And notice also that the cornea is actually external. It touches the environment around it, all right? So it's not like the lens that's on the inside and can rely on the protection of the internal environment. The cornea is on the outside, does the majority of the bending, and it's still exposed to everything around it, all right? So that's important. It has to remain transparent, and yet it has to protect itself from the environment. It has to be very resistant to damage and scarring. It also has to get its own oxygen and food, different than other tissues of the body. Okay, most tissues of the body, we get oxygen from the blood. Like, for example, if we cut our finger bleeds. Why? Because the cells of our finger actually get oxygen and food from the blood. Okay, if your cornea actually had blood serving it, then the cornea would be red. The cornea would be opaque. Light couldn't go through it because it was red. So cornea has to get its oxygen somewhere else, and it does. It gets oxygen and food from the tears and from the air around it, okay, on the outside, and it gets it from the aqueous humor on the inside. All right, so it has its own design. And that also the cornea actually has to remain moist too. If it loses its moisture, it'll get dry and it will become infected. It will have problems. And if it loses any of this, I mean, if it loses its transparency or loses its shape or doesn't get its oxygen, then the optics will not remain clean, all right? But for the most part, day after day, we can see, okay? Why? Because the cornea is pretty tough, okay? That cornea is only about the thickness of half the thickness of a dime. It's like 0.5 millimeter thick, all right? It's only like 12 millimeters across, but its thickness is like 0.5 millimeter thick, all right? And it's designed that it keeps its transparency, and it's designed so that, I mean, if it can accept so much damage. It's like you have to, in order to penetrate the cornea, you have to have a high velocity, sharp object come towards the cornea, to penetrate it, like a shard of glass or a very small piece of metal. And yet, even though it's this tough tissue, you press on it and it's nice and soft and squishy. The reason that the cornea is so tough is because it's made of a protein called collagen. Collagen is the same tissue that makes up skin and ligaments and tendons and bone, all right? But the cornea wasn't named after collagen, all right? They used to think that the cornea was made of a different protein called keratin. Keratin is what you're going to find in your hair and in top layers of your skin and also in your fingernails, okay? So notice that the fingernail is clear and it's tough. All right, so it's not really far-fetched to go and think that the cornea might be made of the same protein that makes up your fingernails. So the term actually comes from the word origin of keras, which is a Greek word for horn or head, And then cornu is actually the Latin word for horn. All right, so both keras and cornu come from horn, which is referring to the protein that makes up horns. So incorrectly, but that's how we got the name. Notice that any term that you hear like keratometer, okay, it's a machine that measures the cornea. Keratitis, it's inflammation of the cornea, or keratoconus, which is thinning of the cornea. All these word roots where you have kera is referring to your cornea, but incorrectly referencing the protein keratin. Okay, so just remember that the cornea is actually made of collagen, not keratin. Now, the reason that the cornea can remain clear is because the collagen fibers of the cornea are stacked and arranged in a specific manner. Okay, the collagen fibers are a certain distance apart. The fibers are laid down in layers called lamellae that are perfectly arranged so that light can pass through clearly and then transparently. Okay, what's interesting though is that the collagen that actually makes up the cornea also makes up the white part of the eye, the sclera. What's different again is the arrangement of the fibers of the collagen. Collagen and the sclera are all crisscrossing. Okay, it's still this tough fibrous tissue, just like the cornea. They're basically made of the same proteins, except that the sclera has to be opaque. It has to be opaque because we don't want light penetrating through the sclera and disrupting what we see. Okay, so think of the sclera as this white or this dark box, where the cornea is just that window of the box. All right, again, all the same collagen making up the fibers. It's just that the arrangement of the fibers of the sclera is crisscrossing and kind of, haywire, where the cornea is perfectly arranged to maintain transparency. All right, so let's move on to the layers of the cornea itself. The outermost layer of the cornea is called the epithelium. All right, the middle, what makes up 90% of the cornea is called the stroma. That's where all that collagen and the lamellae are all located, right in the stroma. And then at the bottom is the endothelium. That's what I want you to kind of think of the cornea as. It has a top layer of this protective layer of epithelium, the main thick layer, which is the majority of the cornea, which really is the cornea itself. And then there's this lower layer called the endothelium. The endothelium is the pump of the cornea. We'll talk about that in a second. All right. But first, let's talk about the epithelium. The epithelium is the top layer of the cornea. Okay, it's anywhere from 5 to 7 cell layers thick in the center and is as high as 10 cell layers thick more towards the periphery. All right, the epithelium has different levels of cells itself. Okay, the first layer of cells, the bottom layer of cells of the epithelium are called basal cells. Okay, that's kind of where all the cells begin as basal cells, and then as they rise higher in the layers, they become wing cells and then superficial cells. So the top layer, the superficial cells of the epithelium, actually are thinned out, and they have actually extensions that go into the corneal tear film. Okay, the tear film actually supplies food and oxygen to the cornea. All right, and in order to increase the surface area of the superficial cells, they actually have villi, microvilli that stick out into the tear. It helps the tear to adhere to the surface, as well as increase surface area so that more nutrients can actually come in through those layers and into the cornea. All right, so the superficial cell is the topmost layer. Then you got wing cells and basal cells. At the bottom of the epithelium is a basement membrane. That basement membrane is very important because that's what actually keeps the epithelium stuck down to the stroma. Now, I said that I only said 3 layers. Well, there are other layers in between. Matter of fact, the cornea actually has 5/6 layers to it. Okay, the epithelium, then the next layer they call Bowman's membrane. Next layer is the stroma, as we've talked about, and then decimase. Decimase is now perhaps being split into 2 different layers: decimase and predecimase, also called the Dua's layer. And then after the decimase is the endothelium. All right, so 5/6 layers actually make up the entire cornea. The Bowman's layer is just the layer that's between the epithelium and the stroma, and it's just a very tough, durable layer that allows for the cornea's basement membrane to attach to the Bowman's membrane. Now, realize that I got this wrong for a while. I misunderstood. Is the BM, basement membrane of the epithelium, is not the same as the Bowman's membrane. Okay, they both BM, but they're not the same tissue. Okay, the Bowman's layer is more a part of the front surface of the stroma, where the basement membrane of the epithelium is the back surface of the epithelium. It's where the two come together, okay? But that Bowman's layer is important because it's extra thick, it's extra tough. It keeps things out from getting deeper into the stroma, okay? The stroma is the next layer down, and the stroma is the part where all those collagen fibers and those lamellae are all allow the transparency of light to come through. And the cells that actually form the stroma are called keratocytes. Okay, there's that word again, kerata. Site, it means cell. Well, kera is cornea, right? So cornea cells make up the cornea along with those collagen fibers. Next layer in line there is the decimase layer. Okay, and the decimase layer actually is a very thin layer that at the edge of the decimase layer is where you get what we call Schwalbe's line if we look at the cornea from the back. Okay, so it's a very, very important layer because it tells us where the cornea begins when we're looking at the angle of the eye. Okay, and the angle is where aqueous humor flows out so to keep the pressure at a certain level in the eye. Okay, so decimase, it also has another layer over top of it that's called the duas that we just recently found out in 2013, and they're still arguing whether they want to call it another layer or not, but it doesn't matter. But the duas layer itself actually has a clinical usefulness. Okay, so we found that this duas layer actually doesn't allow air to go through it. So they actually use this layer as a spot to place bubbles in it for certain procedures. Okay. The decimase is actually the basement membrane for the endothelium. Okay, and the endothelium is only one cell layer thick. It's on the back of the cornea, and that has a super important function. It's to keep the cornea, keep that stroma having a certain amount of water in it. All right, the water content of the stroma is 78%, and it has to stay right there. All right, if it's too little, then it's going to be it's too dehydrated. It has too much water, then it's going to be overhydrated and it'll become more opaque. All right, the fibers, the arrangement of the collagen fibers will be disrupted if there's too much fluid in the cornea. We call that edema. And we can actually see that edema. It looks like haziness when we're looking into the cornea. And if we're looking in and seeing haze, well, when you looking out of the cornea, it's gonna be hazy as well. All right, so your endothelium is a pump that keeps water out of the stroma. And but it doesn't actually pump water directly. It's an ion pump. It pumps sodium into the aqueous humor so that, and then water just chases it. All right. So we have this active pump that's working all of our life to keep our cornea at a certain level of hydration so that the transparency can remain in the cornea. Now I want to get back to the epithelium. Okay, so the epithelium is that first layer, the top layer of our cornea that keeps bacteria and viruses out. It's the part that keeps our eye hydrated and keeps it nourished from the front side. All right, so the epithelium is some of the fastest healing tissue in our body. Okay, so when you hear about the eye healing fast, they're talking about that epithelium of the cornea. The cornea, again, it's like 5 to 7 layers thick, and it's continually replacing itself. For the most part, you get a new corneal epithelial cells every 10 days. Every 10 days, you got a whole new set of corneal epithelial cells. All right. So if you get a scratch on your eye, yeah, it hurts because the cornea. Oh, by the way, the cornea is loaded with a whole bunch of nerves too. Okay, like you have like 300 times the amount of nerves in your cornea than you do on the tips of your fingers. All right, so highly innervated. That's why the cornea is so sensitive. But anyway, so when you get a scratch on the cornea, for the most part, that cornea, that scratch is going to close up within 24 to 36 hours. Okay, your eye might feel completely better after a scratch because the cornea cells close up really fast. All right, and sometimes anywhere between two to 5 days to 7 days. Even a deep scratch, even a really bad scratch that leaves a big old gash, will take anywhere from 2 to 7 days to clean up. Okay, even if you do a full scraping of the cornea. All right, because remember, in 10 days, the entire cornea epithelium will replace itself. You'll have a brand new cornea. You get a brand new cornea every 10 days. All right, so the cornea is constantly replenishing itself, with new tissues. And like I said, you have these basal cells that are kind of in a cube shape that kind of turn into wing cells and then turn into flatter superficial cells, and then they kind of fall off and go into the tears. All right, so the tears are kind of washing off the old epithelium every day as new cells are formed. All right, so let's go back to that how that happens. Okay, so around the edge of our eye, around the edge of our cornea, we have this zone called the limbus. Okay, and the limbus is where the sclera and the cornea come together, and right at that limbus are these, they call them the Palisades of Vogt, where new basal cells are being formed and moving into the eye. And they say that they have some of these same stem cells producing in maybe centrally as well. So there's this constant rollover of basal cells, which turn into wing cells, which turn into superficial cells. So pretty cool structure to be able to do that. All right, back to the sensitivity. So the trigeminal nerve, our trigeminal nerve actually has an ophthalmic branch that actually reaches into our cornea and just loads our cornea with these corneal nerves. Okay, now sometimes I can actually see them under a microscope. For the most part, they're so thin, like the bigger parts of the branch, but the small branches we won't see. Okay, because think of the nerves as going into anywhere from the stroma on up. Okay, and then as they come up, they're like grass growing through the cornea. All right, so if you peel away the epithelium and you're exposing all this grass, all these nerves, that's why a scratch hurts so much. The cornea is so sensitive, it can pick up on little disruptions. What's even more amazing is that, hey, our lids and our lashes and our tear film keep all that junk out all the time. I mean, think of how amazing the eye is. Sometimes you'll walk into an area and you'll just see stuff floating through the air, or, be cutting grass and stuff's flying all over the place, but somehow the structure of the design of our eye keeps all that stuff away from the cornea. And only every once in a long while you actually need to come in and see me to get something picked out, because the eye takes care of the rest of it. Okay, pretty amazing stuff. So this concludes our discussion today about the cornea. Hopefully you enjoyed it. Hopefully you have subscribed already, and if you haven't, don't forget to subscribe. We talk about all things eye related here on Your Eye Show, and I'm happy that you have actually come this far with me, and I look forward to seeing you again right here on Your Eye Show.